All right, this is where I get canceled. Let's do this. Hey guys, welcome back to my channel. So for today's video, I wanted to catch up with Amber Reid. She has put out a couple cancer updates since I have seen you guys last. I know it's kind of taboo at this point to do those updates, but I think from a nurse perspective, I would like to react to some of these videos to see what's going on, to see what's accurate, and to see if I can try to gauge how she's doing. I first want to say that I am in no way saying she does not have cancer. I'm going to take her at her word. And I do not wish this upon anybody, and I only wish her well in her recovery. So let's just get into this reaction and see what she has to say.
Stupid idea to film.
Oh, I also wanted to preface this by saying that I do have her on normal speed, and I skipped the whole first few minutes, about 5 minutes or so, where she does a grocery shopping haul, because honestly, I don't really care.
Another update, because both videos are going to be pretty quick. I'm assuming sometimes I can ramble.
Yeah, so, you can.
As you guys know, I did get a CT. What I had scheduled was an MRI and a CT. I got the CT first, and as you guys know, the only thing that looked off was my lymph nodes were bigger than they should be.
Okay, so I don't know what she's going to say next, but typically with uterine cancer, if it has spread to the lymph nodes will enlarge. And usually, if it involves the lymph nodes for uterine cancer, that is about a stage 3 uterine cancer. Now, again, I'm not a doctor. I am only a nurse. I can't diagnose. I don't have her medical records in front of me. I haven't personally talked to her. But just from the little bit that she's shared, and for that information, it sounds to me like she's probably a stage 3 cancer or above. But let's see what she has to say.
Which could possibly indicate that my cancer has spread.
Correct. The lymph nodes are outside of your pelvic area, which again is one of the criteria that it could be a stage 3 uterine cancer.
If you guys are new here, I do have uterine cancer. So because of the lymph nodes, they wanted me to do a PET scan.
Correct. A PET scan is a type of test that if you have cancer in whatever it is they're testing, in her case it's the lymph nodes, it will light up, and that way they'll be able to easily tell if it's spread or not.
Because that would be able to show if it is cancer. It would light up, my lymph nodes would light up if it was cancer.
Correct.
So I actually was going to do my MRI and my PET scan in the same day. I actually didn't get to do either of them.
Okay, I'm going to let her finish.
I went to the appointment, and turns out the PET scan had a weight limit of 400 pounds. So I am 88 pounds too big.
You know, honestly, I'm happy for her weight loss, but that's still very sad that she could miss out on this possible life-changing diagnostic tool because of her weight.
That was devastating. I was kind of expecting it. I'm surprised it didn't happen with the CT scan. Glad it didn't. So the MRI was also too big for it. There was not a weight limit, but...
No, but there's a size limit. There are open MRIs, but you still have to fit in a circumferential area to be able to get the test done correctly.
It's more so like a body mass limit. I
Mm-hmm.
wasn't able to fit inside of the area that you need to go into. So I didn't get to do either of those. So my appointment today, because the MRI and the PET scan was actually a few days ago, didn't fit. My oncologist still wanted me to go to the appointment today, which was supposed to talk about my results from the MRI and the PET scan. Hopefully I'm not like confusing anyone. I'm trying to like
No, you're pretty basic here.
really give you guys enough information without too much information, if that makes sense. So today I was supposed to be talking about the results from the 2 tests and talk more about treatments. I didn't get results because I couldn't do the test. So as you guys know, I talked about prior how I had 2 options for treatments, and that...
Okay, for this part, in her last video, and I will link it below, in her last 1 or 2 videos, she had stated that she did not know the stage of her cancer, but her doctor had already given her 2 treatment options. Now, the 2 treatment options that are pretty typical for your starting low grade, as you will, stage uterine cancer is usually some kind of hormone replacement pill or some kind of clinical trials treatment and a hysterectomy. Now, you can go further than that and need chemo, radiation. There are all different types of things that you can do depending on the stage of your cancer. And each stage cancer has some subcategories to it, and that all just varies from person to person and doctor to doctor. But typically, the 2 main treatments for any kind of cancer to start is surgical and the hormone treatment or clinical study treatment.
That was this hormone pill, which could actually potentially stop uterine cancer. But sometimes
Possibly.
it don't work.
True.
And what would happen with that is for 3 months, I would take it. They would do a DNC, do another biopsy, see if it worked. If it didn't, I would take it another 3 months, do the DNC again, do the biopsy, another 3 months, do the DNC, do the biopsy. By 9 months, if the cancer's still there, they stop the hormone treatment.
And I'm not sure which medication, which hormone therapy treatment she's talking about, but and again, it depends on what stage. If you're like at a stage 1, you may have 9 months to be able to do this, but if you're any higher stage than that, I think 9 months, in my opinion, is too long to wait to see if something's going to work, because the cancer can be aggressive and can metastasize, which is spread to your whole body pretty quickly. And I think that, that is risky, but with all with all cancer treatments, there are risks to it, and there are benefits to many, and you have to weigh the risk versus benefits. But again, it all comes down to your type of cancer, and comorbidities and a bunch of other factors.
Or I could have a hysterectomy. So those were the 2 options, and I had the choice of choosing.
Mm-hmm.
At first, I was like, okay, I don't really want a hysterectomy because there is a future for me. I'm young, I'm 29, and I've always wanted a kid. It's always been this like weird, oh, I don't know if I want one. I would say that because I've always been too big, the fact that I'm a lesbian.
I don't think you're too big to have a kid. I think that your size, it would be more difficult to get pregnant. I'm assuming with a sperm donor. And you'll have a lot more complications to it.
So Becky can't get me pregnant.
Obviously.
And the fact that my period's always been crazy, so I knew I couldn't get pregnant anyways, even if like we had a sperm donor.
No, not true. Even though your periods were irregular, still at some point in time to be able to have your period, you ovulated 14 days before that. So it is possible to get pregnant even though you're irregular. It's not easy, it's definitely harder, but it is possible.
And also my weight. So it's like I try to ignore the fact that I really, really want a kid. But truth is, been saying for a long time I do want a kid. And getting a hysterectomy means you can't have a kid that's biologically yours, that came out of you.
And that is true, and that's a really hard decision to make. I wouldn't want to be in her shoes.
And that was kind of hard to wrap my head around. And if I had a chance not to have surgery, especially because of my weight, I did not want to have it, obviously.
Very true, because with your sleep apnea, your size, other comorbidities going on, surgery is very dangerous for you. Not to mention any possible blood loss and the scars that happen with the healing. Typically, people with, I know she says she's not diabetic, but typically people with diabetes or obese have a harder time healing from surgery, especially incisions, than the normal average weight person, non-diabetic.
Obviously, because there's a lot of complications. So my oncologist gave me the option. But after she got the CT results and my lymph nodes were enlarged, today at the appointment, she said I no longer have an option.
And that's what I was saying. With the lymph nodes enlarged, it means she's got a higher stage cancer, in my opinion. Allegedly, don't sue me, but the treatment there, the hormone replacement therapy pill that she was talking about earlier, every 3 months for a 3 month or 3 time cycle, is too dangerous for her at this point in time with her level of cancer, in my opinion, to wait to see if it works or not.
The hormone pill is not an option.
Correct.
I have done a lot of crying. I don't know how my makeup's still on. It's been a lot of
it looks rough, but it's
wipe
on.
the tears off really quick. That's why
mine.
some of my foundation's off. It's been a lot. It has been so hard.
And I'm sure it's hard. I'm sure it was a hard decision and one of your options got taken away from you, and you don't have all the and you don't have all the information that you need because you can't get the test done.
I will be getting a hysterectomy for sure. It is already scheduled.
Good.
I kind of can't process. I can process what's happening. I know what's happening. I know the complications because we sat there and talked about them for a long time.
And there are huge complications. Like I said, the healing process is going to be a lot harder on her, especially with surgical incision, just having the surgery with her weight and her sleep apnea. I mean, she's got a tough road.
They really wanted to make it clear what was about to happen, obviously. And there's a lot of complications because of my weight.
I mean, that's kind of our jobs as healthcare professionals, is to inform the patient.
And there's complications for anybody. You could be an athlete, the most healthiest person in the world, get a hysterectomy and have complications.
True.
So at my size, we are raising the risk of complications, obviously. It's almost as if me losing the 83 pounds and me finally getting my life on track. I have fought so many times not to binge and to eat less calories. That is why I am down the weight that I'm down.
I mean, I'm happy for your weight loss. I am. But to say you haven't binged or eaten a lot of calories, if you go back just the last couple weeks of videos, if it wasn't a cancer update or some kind of pre-recorded video, it was you eating on camera. You were eating taco bar. You were eating sushi. I mean, you were eating fried chicken. Come on.
A lot of people have this weird assumption that I've lost weight because of cancer. Girl, my hunger is the same.
It has nothing to do with your hunger. Typically, one of the first signs of cancer is unexplained weight loss.
It's actually a little bit worse because of the hormone medicine I'm currently on. And I still want to binge. Oh my god. But I don't give in to that at all. So, by me changing my life back in October, it's almost like it was meant to happen. Because I know for a fact,
What was meant to happen?
if I was still at my heaviest and I didn't lose those 83 pounds, I wouldn't even be able to go to these appointments because
Okay, girl, no. You lost 83 pounds, but you're still 488 pounds according to your last weigh in. Now, 83 pounds is a huge accomplishment, but you're still 488 pounds.
these appointments are A, hours away, B, there's a lot of walking because this is an amazing cancer center.
And I'm sure those cancer centers have wheelchairs. I would bet my job on it that those cancer centers have wheelchairs for you to use.
Everyone there is so wonderful. They take care of me and they make me feel welcome
And that's their job. And the people in the healthcare field that work in oncology are amazing people.
like they truly care. And that's why they've been so quick to take care of this. You know, it's only been a month.
Yeah, and I mean, you get a cancer diagnosis, we're going to be quick to start running the tests and treatment options and prognosis and plans. I mean, it's a pretty common thing.
That I knew I had cancer, and they're on top of everything.
It's their
They
job.
truly care. It feels good because a lot of doctors kind of shimmy me away because of my weight.
No, you don't get to say that. You can go to my last video. I will run a card up the top where she has said not one doctor has ever mentioned her weight. She doesn't get to sit here and say that no, the doctors just bypassed her because of her weight. Bullshit.
And it's happened. I've talked about it. But these people are incredible. They're getting the job done. My life is in their hands.
Literally. Please listen to them. Please do what they tell you to do.
You know? So it's sorry, I'm just going off on like so many different things. I wanted to make this super fast. Ramble. If I hadn't lost the weight, I wouldn't be able to walk. The place I go is huge, and the surgery would be even more terrifying.
Again, you're still 488 pounds. It's still terrifying. The complications are still there, and they're immense.
Totally more terrifying. And there would be more complications. I know
Pretty much the same complications that you have right now. Difference between 570 pounds and 488 pounds, I'm pretty sure the complications are about the same.
big girl. I know 83 pounds is only a little sliver in the whole scheme of things. Hopefully I'm, saying that right, but you guys know what I mean.
You are, because if you lose another 88 pounds, you're still at 400 pounds.
It's just a little sliver.
It's a big
But
sliver.
that little sliver could possibly save my life. So it's scary.
I mean, I don't want to burst her bubble. Again, I'm happy for her accomplishments. I know it wasn't easy. I don't know.
And they try not to talk about so much the future. They try to just stay right here in the right now. I'm getting a hysterectomy. It's scheduled. It's ready to go. I and my mom, we kind of want to know also, so what happens after that?
And they should give you a rundown of what happens after that. They're going to probably take a lymph node biopsy during your hysterectomy. They're probably going to test it some more. And then depending on what that is, you know, are you good, or are you going to need some radiation? You can't tell me they're not telling you this. Yeah, they want you to concentrate on what is going on right now when it's happening because it's important, and they don't want you messing around and thinking that you have time to put this off. Sounds like they have gotten to know you pretty well, Amber.
So they told me a little bit of information. They don't want to talk about all that because that just can scare me and like even more. But what they did tell me is that after that, they're going to do another CT scan and just measure the lymph nodes and
Lymph nodes.
see, have they gotten smaller or have they gotten bigger? Are they the same? What are they doing?
Yes, because enlarged lymph nodes, if you have cancer, could be a sign of it metastasizing, or it could just be a sign of infection. So, I mean, that makes sense. I don't think she's lying here.
I have faith in myself. If I try hard enough, which I can try hard enough because I'm not trying now like I could
Obviously.
be and should be, that I can lose enough weight to get the PET scan. I have a goal because I want to be as healthy as possible for surgery.
I understand what she's saying. I'm going to let her finish.
No time to mess around.
You absolutely
I
don't.
need to do this.
You do.
I need to.
Your life literally depends on every decision you make from here on out. And I really hope you understand that.
I really truly do. I don't want to be eating fast food and takeout and so.
Again, card above, the last few videos of her eating out, take food, junk, processed, fried, high in fat, high in cholesterol.
Sodium and fats and all that type of stuff. I don't want to be eating that.
But you have been, and you need to stop.
Before I get surgery. That's terrifying to even think about because healthy foods, less foods, make you feel better. Makes me feel better. So I feel like it's really going to help.
I don't want to be mean, but since when? Since when? If she knows that they make her feel better, why hasn't she done them in the last 6 years?
Not only that, but it's going to help with more weight loss. And I want to be the best
you do it right,
that I can be realistically. So, by the time that I have my surgery, oh my God, saying that scares me because all I can think about is all of the stuff that they said and all the complications. Oh my.
It's a risk versus benefit. You have to weigh that, and you have to be positive.
Oh my gosh, that's like all I can think about. I'm going to be honest, that's kind of where I'm at. But I want to be exactly 100 pounds down. So I have to lose about 17 pounds in a few weeks.
Now, honestly, at your size, if you do this right, I don't know what a few weeks is. I mean, it could be 3 weeks, it could be 10, I'm not sure. But 17 pounds for a person your size it's very doable.
And I know I can do it because I'm actually going to truly try. I'm going to do the calories, I'm going to do the measuring, I'm going to do the weighing. I haven't been doing that.
But when you say you do, it hasn't worked. I'm really worried for her.
And that is why I'm losing weight so slow. So I am going to actually be on a diet. You know what I'm saying? I hate that word, but if the word diet is going to change my life and help me during surgery, then I'm just going to go with it.
I don't know. I mean, maybe it's just me. Hate me in the comments if you want, but I mean, her attitude towards this is it's just coming off weird to me.
So by losing 100 pounds exactly, that would put me at 472.4, which also makes me closer to 400 pounds. And if I try hard enough, I could reach those 400 pounds within a few months. You know, I'm not gonna be like crazy and say 2 months, 3 months, but I'm going to try because I need
Are
the
you?
PET scan. I need.
You absolutely do. It's a life or death situation. I really hope you realize this. I really think you can do it if you can put your mind to it. And I think that this life altering moment is hopefully your rock bottom.
Need them to do it because this will light up anything in my body that is cancer. We don't know. We don't know what's there still. But we're gonna figure it out. We're going to. I have so much faith in myself and in the people at the cancer center. I have so much hope, and we're gonna figure this out.
I hope so. And I hope you listen to what they have to say. They are the professionals. They do this day in and day out. I know everybody's different. I know every cancer is different. But they know what they're talking about.
I'm gonna be able to wake up from my surgery.
Hopefully.
Hopefully. I don't know why I say hopefully. I'm never gonna bleed again, okay? I'm gonna be going through menopause at 29 years old.
You are. And it sucks. But it's better than dying in a year or two.
And I know a lot of young girls deal with this, but it's crazy to me that I'm.
Why does everything like this seem? Is it crazy to her? Is she just? I mean, I know she's in shock. I know she's going through a lot, but everything just seems crazy to her. I don't know.
Never gonna bleed again.
I would consider that a good thing.
I have been dealing with this for years,
And not once did you go to a doctor or a gynecologist to talk to them about it.
a lot of people have also said, you know, this is your weight. I mean, this is your weight. Wow. Of course, that's my weight.
Yeah.
A lot of people said that you have cancer because of your weight. You did this yourself.
Not necessarily. Genetics has something to do with it. Granted, if you're obese, then you do have a higher percentage of likelihood of getting uterine cancer almost with any other cancer. Also, I mean, I wouldn't say, I don't think it's kind of your fault because you're obese. I think it's more your fault. No, it's not your fault. I think the irresponsibility of not getting any pap smear ever in your life was a factor. Getting cancer is nobody's fault, but there are things that happen, like smoking, like not going to the gynecologist, like being severely morbidly obese, that's going to increase your risks for cancer. Genetics, again, plays a lot into it. Getting cancer is not your fault. Not taking the preventative measures that you know happen and work is your fault.
So, okay, you might be correct, but that's a horrible thing to say to someone.
It is a horrible thing to say, but they're not correct. I mean, it's obesity. I will link something down below that will show you obesity to cancer rates and how the likelihood of getting cancer while you're obese increases.
That's like telling a smoker who has lung cancer, this is your fault because you smoke. It's not.
She said that in a way that she said that to somebody before.
I think you should say it to people. It's kind of harsh. It's kind of rude.
It is harsh and rude, and you shouldn't say it to people.
Whether it's true or not. And it is true. People who are my size, not people, females who are my size, have a very big chance of getting uterine cancer.
And a lot of other things.
That's why
not going to the gynecologist ever in your life at 29 years old and getting a pap smear. I mean, you don't even have to go to your gynecologist. A lot of family practitioners will do it too. Not getting that done is your fault.
I want you to go to gyno. Actually, I don't care what weight you are. Just go.
I don't care what weight you are either. You should go to a gynecologist or your family physician or somewhere and get a pap smear done every year if you're a woman.
And I'm sure you guys are all responsible adults. You probably have already gone.
Most of us are.
I just wasn't responsible. I didn't care enough.
That's really sad. That's really sad that you're going to admit it. That you didn't care enough, that you're not responsible. It's really sad.
It was a lot bigger than it should have been. And sadly, I didn't love myself enough. And
I don't know if I would say you didn't love yourself enough. I just think you're irresponsible and maybe a little bit lazy. And I'm not trying to say this to be mean, but possibly a little uneducated. You didn't have the greatest of childhoods or possible role models from what you have said. So I will give you the benefit of that doubt that maybe you weren't educated, but at some point you knew, because now you're saying that you knew you should have gotten it done.
You know, it's my fault that I have cancer.
It's not your fault you have cancer. There are so many factors that go into cancer. Some people who smoke all their life will never get cancer. Some people who are obese for most of their life will not get cancer. It's not your fault you got cancer. It's your fault you put yourself in a higher risk bracket for cancer. It's your fault that you did not go to the gynecologist or a family physician to get a pap smear done every year to possibly prevent the extent of which your cancer is now.
And it'll be my fault if it spread. And
it's not your fault if it spread. I'm not going to go into that whole thing again, but if it spreads, it spreads. That's the way it works. There's nothing anybody can do, not obese, a non-smoker. There's nothing that anybody can do to stop it from spreading if you don't catch it early enough. You catch it early enough by your pap smears.
And that's hard to grasp because a lot of the time it's not someone's fault that they have cancer.
Exactly.
You know, it just picks and chooses who they want.
Exactly.
But with this type of situation, it is my fault.
It is not your fault. With this kind of mindset, I mean, I know that you get a lot of haters on your channel. I know that people leave you horrid comments. But please, just, I'm a nurse. I hope you see this, and I hope you realize that it is not your fault you have cancer. It is your fault that you put yourself in the higher risk factor brackets to get cancer, but you did not directly cause your cancer. You cannot cause it or stop it from spreading. It is what it is. Your weight gain, you're not taking care of yourself, has put you in a higher risk factor to get the cancer, but you did not cause the cancer.
And I have said that before, and I get so many sweet messages from you guys telling me, don't say that. This isn't your fault.
It's not.
I feel in the depths of my soul that if I was of a normal weight, this wouldn't be happening.
And again, that's just not true. People of all weights and ages can get uterine cancer.
I truly believe that. And weight loss will help. It will just help me in general, like my everything. And I'm actually gonna be like truly doing this thing because I have to. There's no.
I don't know. You're not convincing me that you are really all for losing the weight and getting your shit together just by the way that you're talking in here. I mean, I really hope you do. You're just not giving me that impression at this moment.
Ifs, ands, or buts, this is the type of situation where it's like, it's not, I might, I'll wait a few days, let me have my binge meal beforehand. It's not like that. It's not like that. It can't be like that.
It can't be like that. It's literally life or death at this point.
This is like now or never.
Exactly. Life or death.
I am in control of saving my life. So are these amazing people at the camp.
You're in control of a good portion of it, and I really hope you listen to these people, and I really hope you mean what you're saying.
But it's not just them. It's not just them. I have to work with them. And that includes weight loss and being as healthy as I can.
Just like anything else, people can't give you a magic pill or snap their fingers to make you better. You have to work on yourself, period.
That's a goal for myself. They didn't exactly tell me that.
They shouldn't have to.
They said regarding my weight and the recovery and the complications, it really, it's a big part of what I think about every time I think about the surgery. I'm going to be honest.
It should be.
It's like the negative is weighing out the positive, but I have this weird feeling, I guess, that going into surgery at this weight, eating junk, will make the surgery a little more worse than...
Okay, going into surgery at this weight, no matter what you eat, is still going to be the complications that it's going to be. There's a very huge chance, especially after what you said, what happened with your DNC, that you are not going to wake up from the surgery because of your sleep apnea. There's a really good chance with your weight and other comorbidities that you are going to have a hard time healing.
And eating better, a little less weight.
And let me give you a hint, after surgery, when you have that wound, when you have that incision, the best thing for you to do is to eat protein to help aid your skin and your body into producing what it needs to produce to heal faster.
That's the way I see it. Could be wrong. Who knows? So I guess one last...
But you don't believe you're wrong. I mean, you really are putting off this, I don't know, I guess arrogance.
Thing is, a lot of females, from what they told me, actually get hysterectomies where they take it out of their vagina. I know, like, I've had people tell me, I hate when you say that word, but we're all adults here, I hope. But they can't do it that way for me. Because they said when it's done like that, you're not laying flat. You're not just laying flat. You're laying flat and laying tilted back.
Yes, your arms.
They set up my weight.
Your legs are above your head.
All of my organs, all of my body, and all of my weight will be going up here since I'm laying. And
it's going to make it harder for you to breathe and possibly not wake up. You could possibly suffocate even with the anesthesiologist and everything there.
You know, like that, where my head's down here. And they said that's going to be very bad for like the breathing situation. So what they're going to have to do is, I hate even thinking about it, is do a very, very big incision.
It's going to be big, it's going to be deep because of the layers, and I'm not trying to be mean, but the layers of fat that they have to get through just to get to your uterus. You are going to have a massive incision, and it is going to be hard to heal. It's going to be very important to do what they say with your wound care and your diet, which is increasing protein and fluids, because abdominal wounds are some of the toughest wounds to heal. They need to heal from the inside out, or it creates problems.
And they tried to emphasize that, so I expected. They really tried to like beat it into my head, like
good.
It's going to be a very big incision.
Good. And they need to do extensive wound care on you and probably do a home health nurse to come to your house to do your wound changes because I don't know that I would trust you to do it, Becky to do it, and it has to be in a semi-clean and sterile environment. And I know you don't have insurance, but the best thing to do is to have a home health nurse come out and do your wound care for you. Because we've seen what happened when you stubbed your toe and you ended up getting cellulitis from it.
Because I'm bigger, and it's going to be hard for them to see.
And get to.
I just hope the surgery goes good. It's not for another few weeks. So for me, it's like, okay, it's coming up. But I'm also like, okay, let's hope it doesn't spread. That part also scares me. So I just have a lot of like mixed emotions. I can't believe I've talked for this long, you guys.
And it's pretty normal to have all these mixed emotions. It's new. You've never been through it. You're getting all this information thrown at you. You have these preconceived ideas about what cancer is like, what's going to happen, and then you get to the bad thoughts, the prognosis. You know, am I going to make it? Is it worth making it? You know, chemo can make you sick. What's your quality of life? I mean, it's a huge decision and it's very stressful. You need to listen to the people that are on your healthcare team. Ask them the questions. Do what they say. Don't do what you think you know is better. You need to do exactly what they say. You have a history of thinking that you know better than all of these doctors, and you just don't in this situation. You just don't.
As I promised, I was only going to like sit here for 5 minutes. That didn't happen. So
no, we've been here forever.
I just told you guys like the main parts, not like everything, because it's a lot of information. I was at the cancer center for a few hours today and saw so many people.
I'm really curious the main parts or some of the parts that she left out, because it could probably be pretty telling.
Again, they're amazing and I'm so freaking grateful. Anyways.
Just remember that you're saying this because you also have a history of turning on doctors. Of turning on doctors when it fits your narrative.
That's my update. I think what I'm gonna do is I have 5 or 6 pre-recorded videos. I will be uploading those after this video, and then once those are up,
I kind of have a hard time believing that these are going to be pre-recorded, because she's been doing pre-recorded videos for a week or for a couple weeks, and the ones that she does label pre-recorded, they're okay, but the last few that I've been talking about, the KFC mukbang, the sushi or whatever, lobster mukbang, the Taco Bell mukbang, she didn't say any of those was pre-recorded, so she really, again, still needs to work on her diet if she's so gung-ho about doing this.
My videos will be like from now, so not now today, but in real time, if that makes sense. So anyways, I'm gonna stop rambling. I will see you guys in the next video.
Well, I don't know that I have much more to say about this. Again, she's got a lot of work to do on herself. She's got a lot of information that she needs to sort through. I am not saying that she doesn't have cancer. I am saying that there's a lot more things that she needs to think about. I really hope she takes it seriously about her weight and her doctor's suggestions. And I hope that she takes care of herself. A support system at home is super important. I think that she has that with Becky. At least I hope so. I know her mom's been there. This is the first time that she's seen her mom in 12 years. And she's going to be going back. I'm not real sure where she lives. But states away. So I hope she has that support system. I hope that she listens to the doctors, and I hope that she takes this very, very seriously, because this is literally life or death. So that's it for this video. Thank you guys for watching. If you have any questions, comments, concerns, complaints, leave them down in the comment section below. I would be super happy if you would subscribe and you hit the bell button so you'll be notified if I ever go live, which is rarely, or if I upload a new video. You can check me out on all my social medias. I have now an activated Patreon down below if you want to. Nobody is forcing you. Don't feel like that you have to. So yeah, that's it for this video. I hope you guys stay safe, stay healthy, and wash your hands.